Two local hospital systems will now restrict younger visitors starting tomorrow, and this is because of cases of flu, RSV, and COVID surging across North Carolina. The new measures will impact regular hospital areas, emergency rooms, among other locations. And if you think back, you might remember these kinds of rules before, especially during the pandemic. The timing now, though, might leave you with some questions.
Yeah, so tonight, experts warn the public, don't be fooled. They say these viruses are still putting a lot of people at risk.
Our goal with these additional measures are really to protect our patients when they're at their most susceptible.
New measures going into effect at local hospitals with respiratory illnesses on the rise. Starting tomorrow, Novant and Atrium Health prohibiting children under 13 from visiting. These restrictions coming later this season than last, but still par for the course, according to Atrium Health infectious disease doctor Katie Passaretti.
When we hit that kind of tipping point where we're really seeing a high burden within our communities, within our hospitals, we layer on additional measures to make sure our most at-risk patients are as safe as possible within our walls.
While these measures are coming later, Dr. Passaretti says it doesn't necessarily mean fewer cases. State data shows emergency department visits for respiratory viruses have peaked the last week of December and first week of January. What's different this year? Which viruses doctors are seeing more often?
I don't know that it necessarily means specifically for flu and RSV that it'll be a lighter season. I think we're just seeing, especially right now, a little less COVID, so we don't have that third virus as much in the mix as we did last year.
As for how long these restrictions will be in effect, Dr. Passaretti says it's too early to tell, but she says hospitals are intent on making sure families are still able to connect.
There may always be a need for someone to visit a loved one in the hospital, and absolutely there is a pathway for exceptions.
And for both Novant and Atrium Health, exceptions are typically allowed for those visiting a family member who is in end-of-life care.
And so in these cases, the parents of the young kids should speak to the patient's care team to make those arrangements.